Chapter 9, Patient Education and Health Promotion. These are the clinical objectives for this chapter. So patient teaching is very important um, in nursing. It helps to prevent illnesses. It helps to promote wellness among our patients. So as an LPN, you will be responsible for reinforcing teaching. The registered nurse is the individual that will be initiating all teaching efforts. However, the LPN um, should be reinforcing teaching of information the RN has already started teaching. So it's important that you, as the LPN, understand how to properly educate your patients. We can educate patients on a variety of things. We can educate them on their disease or disease process, diet that they should be taking, medications they should be taking, treatments that they may be having, or self care. Maybe they're going home and they need to understand how to perform a treatment, how to self catheterize, how to take care of their trachs, how to change an ostomy bag, how to give themselves or their loved one the tube feedings or whatnot. And so it's important that we understand how to properly educate our patients and or their family members if their family members will be helping to teach. Um, Teaching our patients can help prevent medication errors because they need to be able to understand not only the medications they're taking, what those medications are for, how to properly administer those medications, um, and things like that. What times a day should they be taking those medications? Should they be checking their blood pressure with it? Should they be checking their heart rate with it? Things that they should be doing in addition. So a lot of times, um, especially people that get hospitalized, when they go home, they get confused thinking, oh, do I just continue my medications as I did before I went in the hospital versus, not understanding that, oh, no, the changes that were made in the hospital were the changes I should continue with. So we need to be making sure we're properly educating that as well to prevent medication errors. Um, if they had surgery and they can't lift more than 10 pounds for the next 2 weeks. They need to understand that and why and what could happen. Their wound could dehisce, meaning open up again, or, cause, other issues or whatnot. So they need to understand those things. So we properly educate our patients to prevent hospital readmissions, to prevent medication errors, to prevent um, the post hospital mortality rate, prevent exacerbation of illnesses and things like that as well. Okay, so before you start patient education, you need to assess a person's learning needs. What is it that they need to learn? For example, if I have a diabetic that's been a diabetic for 30 years, then they probably don't need to start to learn about diabetes from the beginning, right? If we're changing their medications or we're now introducing them to insulin, so they need to learn how to do injections. We don't need to start from scratch on what diabetes is and whatnot. We can just educate on the changes and things like that. If they're not, having a proper diet, then, educating on that. So we need to assess what are their learning needs? What do they already know? And what do we need to add to or correct as far as what they believe they already know. So assess their learning needs. That's the first thing we need to do. And there's a lot of different factors that can affect a person's ability to learn. For example, their culture, different cultures have different beliefs or uh, cultural values, I should say, about learning and who should be involved in that or whatnot. Confidence. Are they confident in the in their own ability to learn, or is that something we have to work with and adjust? Helping to build their confidence. How do we build their confidence in their ability to be able to learn something? What are the patient's abilities? Um, for example, if we're teaching how to do an injection and the patient has arthritis, maybe they can't um, properly hold that needle to do that injection. So maybe we need to get a family member involved to help with that process if they're going to need to get injections when they go home. So what are their abilities? What is their readiness to learn? If a person is not ready to learn something, then they're not going to put forth the effort to try to learn that. And so, if a person's not ready to learn about their disease process, then you teaching them is not going to help them to understand. They're not going to focus on what you're saying or understand what you're saying if they're not ready to learn about that. Now, just like we needed to form a nursing care plan, we need to form a teaching plan as well, and we'll talk about that. But we do need to be able to form a teaching plan for our patients as well. So, what needs to be taught and how we're going to teach it and things like that, and evaluate just like we have to evaluate, in our nursing care plan. So, we'll talk about that momentarily as well. Well, in your book, there's a focus assessment and how do we assess for teaching and learning and some things we need to assess for. It's in your book in chapter 9, page top of page 126. I'll just read a few of those things you want to assess for when you're assessing a person's learning abilities. Like we already said, do they have barriers to learn? What is their ability to learn? Any cultural factors we need to consider. Their language level. Are they literate? If we're teaching by giving them a pamphlet, can they read the information and understand and comprehend the information? What are their health beliefs, their readiness to learn, their goals? We need to look at their goals. Dominant style of learning, which we're going to talk about here in a minute. Do they have family support if needed? Do they have any concerns about being able to learn things like that? um, and making sure we have a good environment for teaching and learning. All right, a couple other things I want to bring to your attention, different domains for learning. There's a couple different domains. They're actually in your book on page 125, the cognitive domain, the affective domain, and the psychomotor domain. So when we talk about the cognitive domain, that's your ability to learn different process or process information. So we'll just read what the book says. The learner takes in and processes information by listening to or reading the material. So that's the process of you learning information. So the book uses the example of learning how hand washing, how to properly hand wash so that you can break the chain of infection. So you're cognitively learning something. The affective domain is the material is presented in a way that is appealing to the learner's beliefs, feelings, and values. And so the book uses the example of if you value cleanliness, then you'll want to learn about how proper hand hygiene can prevent infection and things like that. So appeal to what your beliefs, your feelings, your values are when you're teaching. And then psychomotor domain, the learner process the information by performing the action. And so that basically means you learn hand washing by actually doing it. That's the psychomotor domain. All right, so we have different styles of learning. as well. And different people have a dominant style of learning in which they learn best. So your different styles, like you have a visual learner, an auditory learner, or a kinesthetic learner. So visual learners learn by seeing something. So maybe they watch you do a treatment, or maybe they watch you um, administer an injection, or they watch you, watch you do something, or you can show them a video on how something is done, or show them a video on um, how the disease affects the body or something like that. So they're visual learners, whereas auditory learners learn by hearing. So just hearing the information, you explaining the disease process to them, you explaining how that treatment's going to be done, or you explaining things like that. So they're auditory, they learn by hearing, whereas your kinesthetic learners learn by actually um, doing a task. So I learn best by, like we talked about with the hand washing, you're teaching me how to hand wash. A kinesthetic learner would learn best by actually doing that task. So just because a person's dominant uh, style of learning is one thing doesn't mean they can't learn by using any other method. For example, if a person is a uh, dominantly auditory learner, that doesn't mean they can't learn by visual modes as well. Um, especially when we have tasks that have to be performed, even if a person is a, primarily a visual or auditory learner, um, if there's something that needs to be done, for example, learn how to give an injection, learn how to change an ostomy bag or something like that, then you definitely want to uh, include kinesthetic learning and have them actually performing a task so that they can um, demonstrate to you that they actually understand how to complete that task. When you're listening to your patients um, during your education sessions, listen to them and how they're responding to different things that you may say. And that can give you some clues as to what their mode of learning is, or what mode they prefer learning best. Okay, so first step in developing your teaching plan is you're going to assess the patient's learning needs. So you want to assess what their current knowledge base is, because we don't need to teach something if they're already knowledgeable in an area. For instance, what's their knowledge of his or her disease process? Like I said, if a person has had diabetes for 30 years, they may have a good knowledge base. If they just got diagnosed, then they may you probably have to start from scratch as far as teaching them about that disease. What's their diet like? You want them on a low sodium diet. If you talk to them and they're selecting all good items, then they have a good knowledge base. But if they say, oh, well, I know, what I should be eating, and then they tell you they're eating this from the can and this processed meats and things like that, then that tells you that they don't have a good knowledge base, and you need to really, educate. What's their activity level? Are they, just talk to them. The medications, talk to them about their medication. They say, yeah, I know, what I'm supposed to be doing with my medications, but yet when you talk to them and they're administering half the dose at this time and another half at that time, then maybe they don't have a good knowledge base. So just kind of talk to the patient and see what it is they're doing. What is their current knowledge base of the situation, so that you can, meet them where they are. And again, if they have a good knowledge base, you don't have to start from scratch. Maybe you can just correct some things where um, they may be incorrect in. Or also, with healthcare constantly changing, things could have updated and they may need updating their knowledge as far as, the new criteria for certain things or things like that. Once we've established what their learning needs are, then you need to be able to prioritize so that you can concentrate on, what's important first. So, as we stated previously, a lot of different things can affect a person's ability to learn. For example, does the patient have poor vision? So then maybe, giving them something to read is not the best way to learn. Do they have poor hearing? Or, if we're talking about going back to vision, maybe they need large print or things like that. Do they have poor hearing? Make sure they have their hearing aids in place when you're, if they use hearing aids or whatever. Is there impaired motor function? Like I said, if you have a patient with arthritis, then maybe they can't properly hold that needle to give themselves that injection. Or, um, can they open that medication bottle, or things like that? Are they illiterate, or have impaired cognition? Do we need to get family members involved? So a lot of different things can affect, our patients. Um, ability to learn. Also, things that can affect a person's ability to learn. Is the patient tired? Are they in pain? Are they anxious? Are they distracted? If I'm in pain with a 10 out of 10 and you're trying to teach me about this medication, I'm probably not focusing on what you're saying because I'm in so much pain. If I'm tired, exhausted, I'm probably not going to be able to focus. Um, you know, so you need to look at those things as well. Um, as far as, things that can affect your person's, is this the right time that I should be trying to teach my patient if they're, in not in the right frame of mind? So some things we need to consider when we're talking about teaching and educating our elderly patients. A lot of times our elderly patients may have visual or hearing um, difficulties. So if they do have visual difficulties, do they wear glasses? Make sure they have their glasses. Do they need large print materials? Is the lighting good? Can they see, what you're doing? If we're talking about hearing, do they wear hearing aids? Do they have their hearing aids in place? Um, maybe it's one side that they can hear better on, then, talk on that side. A lot of times, our elderly patients may have issues with short-term memory loss. Their long-term memory stays intact, but then they have difficulty with short-term memory loss. So then, do we need to include our family members when educating the patients? Um, so that the family members can learn what needs to be learned. You don't want to use a lot of medical jargon. Talk to them in plain terms. Um, ask, don't ask a bunch of questions back to back to back. Ask one question, and give them time to respond before going on to the next question. Take small steps with the individuals, and then allow them to ask questions. And then you ask questions, at frequent intervals to make sure, they've understood what you've said. So, as we previously stated, cultural values can also, impact your client's ability to learn or whatnot. They may have some different ideals or values or expectations for their care should be, how they should be treated and cared for and whatnot than you. And so you just always have to remember that your patient's cultural and personal values um, may differ from yours. And if they do differ from yours, you still need to respect your patient's values. Don't try to push your values off on them. You still have to respect, what they're saying and their beliefs. And how they, feel. So, like I said, another thing that can impact your client's ability to learn is their level of confidence in their ability or whatnot. Everybody might not be confident or feel that they're able to learn things. And so we want to assess their level of confidence as well. And so, if they're not confident, then try to break things down into small steps. Don't try to, teach them a multi-step procedure um, all at one time. Break it down. Give them little small wins, and then when they achieve those small wins, give them praise. Say, see, look, you did it. Give them praise, encourage the person um, at each of those little steps. And so as they continue to um, build on those steps, you give them praise every step of the way. Um, you want to make sure you develop the plan in collaboration with the patient. Like just like the nursing care plan is done in collaboration with the patient, the teaching plan should be done in collaboration with the plan as well. And never assume a person is literate. Every person may not be literate, so don't make that assumption for your patient. Okay, so the education plan begins with assessment of the data, like we said, then developing the goals or objectives. And just like the nursing process, um, you have assessment, plan, implement, and evaluate, right? So the teaching plan has to include analyzing the assessment data once you've assessed it, establishing behavioral objectives. Your behavioral objectives are those are the desired changes or additions to the current behaviors and attitudes. Um, and so it should be meaningful to the patient. So, what behaviors do we want to change? What attitudes do we want to change when we're talking about a teaching plan? Do we want to change their uh, we talk about changing behaviors or attitudes, maybe like changing the way they eat, making better food choices, making better, um, having a better attitude, or changing their behaviors, or add something to the behavior of what they're actually doing, um, and create a plan to assist the patient in reaching the goals in a timely and effective manner. So when we're looking at this, all members of the healthcare team should be included in developing the teaching plan, including the patient. You always want to include the patient in developing this plan, because these should be goals that the patient wants to work towards. If they're not goals that they're not the nurse's goals, they should be, the patient's goals. If they're not goals that the patient wants to work towards, then they're not going to put all their effort into learning and learning the information and changing their behaviors, their attitudes, or, demonstrating how to properly perform a task or something like that. So make sure you do this in conjunction with the patient and all members of the healthcare team. There's a lot of different things that we can use um, when we're educating our patient. A lot of different things we can use: books, pamphlets, audiovisual materials, things like that. Also, if you have a patient with a different language, um, you might want to try to find pamphlets and books and things like that in their own language. Um, or if maybe need an interpreter or something like that. But a lot of times, if you work at a hospital that has a lot of individuals coming to that hospital that speak a certain language, for example, maybe your hospital has a lot of Spanish speaking patients, and so then they may have material printed up in that person's language already. So try to find things that they can, understand. And again, remember we said don't always assume a person is literate and that they know how to read. And so that may be a conversation you need to have with your patient. Audiovisual materials, especially if your patient, if you've determined that your patient is a visual learner, that might be helpful. Hands-on equipment. If your patient is kinesthetic learners, especially if you're teaching your patient how to perform a task. such as how to give an injection, how to change an ostomy bag, how to administer tube feedings, how to change a dressing. If it's something that's hands-on, then you really want to, have them practice that hands-on task and demonstrate it back to you to ensure that they've, learned the material or learn how to complete the task. Your local government agencies often have printed material that you can use for education. The internet could be a good source, for patient teaching. You just want to make sure you're using valid, reliable, credible sites when you're using the internet. Your hospital social workers can be good sources of information as well. Utilize them. They're there to help, in situations like that. So in our planning phase, we will have, worked with our patient to develop our goals and prioritized our goals, as well as identified the strategies that we would use to achieve those goals. And so now, once we've completed that phase of it, we're ready to actually implement. So implement those strategies to help our patient, um, learn or achieve, whatever those goals were. Um, you want to try to do, you can do it in one-on-one settings with your patient. You can do it in a group setting. Sometimes there's a class that your patient can go to, learn about certain, diseases or different things that may be going on with them. They can, attend a class and so then they would be in a group setting. Um, make sure the patient's comfortable. You don't want long teaching sessions. Make sure that your teaching sessions are short because your patient already have different things going on with them. We don't want to uh, keep them in long teaching sessions or whatnot. Like I said over and over, make sure your patient is involved in the process, as well as if they want their family members involved in the process as well. Also, you can incorporate your teaching in your daily care. It doesn't necessarily have to be a formal teaching session, that this is a formal teaching session. For example, if I had a diabetic patient and I was assisting them to the bathroom, and then they um, got up and started walking to the bathroom without putting their shoes on. That's a perfect time to do education about always wearing shoes when walking around, and and for what purposes and things like that. So that's a perfect teaching opportunity right there. So it can be as a part of your daily care. It doesn't have to be just a formal teaching session, but you're going to document it no matter whether it's a formal or informal session. You're still going to document all teaching that you've done. Okay, the last phase of it is going to be the evaluation. So you're going to evaluate whether your interventions were effective. So did your patient learn what you anticipated or hoped that they would learn? How are you going to evaluate that? You're going to ask questions so that they can give you feedback on what was taught. You can also allow the patient to do return demonstrations if it was something um, that they had to physically do. They can do a return demonstration or whatnot. You can do the teach back method where they teach you um, what was uh, what was taught or whatnot. So you need to be able to evaluate, did the patient learn what you intended for them to learn? If they did not, and the patient should be involved in this process as well. They're involved in the planning phase. They should also be involved in the evaluation phase. Do they feel they've accomplished their goals and and learned what they had hoped to learn? If the patient has not accomplished the goals that were set out, then maybe we need to relook at our goals. Were they too lofty? Do we need to adjust those goals? Or maybe the goals were good. We just need to adjust our interventions and come up with some new interventions. So, just like with our nursing process, this is ongoing. We constantly evaluating. We could be constantly adding goals as well, and to ensure our patient, has learned everything they needed to learn. Okay, so all patient teaching must be documented. You have to document all your patient teaching. You're going to document what you taught. You're going to document who you taught. So did you teach the patient? Did you teach their family member? And if you taught a family member, you want to be specific as to which family member you taught. Don't just say taught patient's daughter. What if they have 5 daughters? You want to be specific and say you taught patient's daughter Linda or whatnot. And so you want to document what you taught. You want to document who you taught. You want to document how you taught it. So, did you show them a video? Did you have a one-on-one conversation? Um, you know, did you have them do a return demonstration? What is it? How did you teach the task or whatever it is you were trying to teach? And then how do you know the patient um, understood the information? Did they teach it back to you? Um, did they answer your questions appropriately? Did they do a return demonstration? So you're going to document all of those things, when you document your teaching, because um, lawsuits have come across where patients have sued and said that they were not properly taught a task, and they have won. If it wasn't documented, it wasn't done. And so if you don't document it, then it's considered to not be done. And so a patient can come back and sue and say you didn't teach them something, so you have to document it. Henry is a nurse working in a physician's office setting. If he is teaching a patient to draw up insulin and watches the patient perform this task, he is teaching in which domain? The answer is 4, psychomotor domain. In the psychomotor domain, the learner processes information by performing a task. In the cognitive domain, the learner processes or takes in and processes information by listening to or reading the material. And the affective domain is it's presented in a way that appeals to the learner's beliefs, feelings, and values. And there is no effective domain.